Hi, Chris Hansen with the Functional Physical Therapy Center. Squatting is one of the most important activities or the most important exercises that you can do. It can cover both lower extremity, trunk, and some mobility for the upper extremity when you work that one exercise. The squat is basically the king of all exercises in my opinion. A lot of times people come in with difficulty with squat, and a lot of the difficulty comes from a lack of mobility that they have somewhere in the lower extremities, in the hips, in the ankles, or up in the thoracic spine. Today I'd like to show you a mobility workout or a mobility series that you can work on to help improve your squatting activities. So the first exercise I'd like to work on with the squat is just a stretch for the toe extension, so a stretch for the toe flexors. An easy stretch here. All you're going to do is you're going to sit back with your toes pointing forward and just kind of sit back on your heels and let your body weight sink in on the toes and allow them to stretch out that way. With this stretch here, you're going to spend about 1 to 2 minutes stretching that. You kind of work back and forth, letting yourself stretch out there. The stretching of the toes into extension allows you to stretch out a little bit of the plantar fascia as well as the toe flexors, which are the opposite of the connection or the opposite side of the lever of what the Achilles or the calf muscles would be. So you spend about 1 or 2 minutes rocking back and forth. You can spend a little bit more time on one side or the other if the one side feels a little bit more immobile. And then as soon as you feel kind of comfortable and relaxed and able to kind of get into good stretch in there, then we move on to the next exercise. So the next exercise you're going to work on is just a stretch for ankle dorsiflexion mobility, specifically for the forward bending of the ankle as well as the soleus muscle, which is one of the smaller muscles in the calf group. To do that stretch, all you're going to do is bring your foot forward into kind of the kneeling or the lunge position there. And what you want to do is keeping your heel flat on the floor. A lot of times I have people just kind of push their heel down with their opposite foot, and you're going to lean forward, stretching out the Achilles and the calf down that way. You're going to hold that there. You can kind of work a little bit more towards the outside angle. Oftentimes it's easier to go inside because you roll in on the foot and you kind of pronate or flatten out the foot, but you want to roll forward, bringing your knee basically over what would be your second toe or the middle of your foot, and continue to stretch that out. You know, work the one side for about 1 or 2 minutes. You should feel that stretch down into the back of the heel and along that lower part of the calf. Once you feel like you got a good stretch in there, working around that for 1 or 2 minutes, then we'll go ahead and switch to the other side. And once again, remember, important, keep your hips lined up straight, but keep your heel flat on the ground. I like to do these stretches without shoes on because it helps emphasize keeping the heel down, allows you to not cheat with the elevated heel that happens often in the shoes. So go ahead and work that, making sure to keep it in line. Keep it in line or a little bit to the outside, bringing what would be your kneecap right over the middle of your foot or your second toe, the toe next to your big toe. Continue to work that back and forth until you feel a good stretch. You're allowing it to work over here. The calf or the dorsiflexion of the ankle is where one of the biggest areas of immobility is. It affects people being able to squat. It leads to some adjustments that lead to weakness or set up for improper mechanics with the squatting activities. Also, the lack of dorsiflexion mobility, lack of mobility in the calf is related to weakness or lack of function in the glutes, which are one of the most important muscle groups when you are squatting. After you get that ankle dorsiflexion stretch, what I like to do, just because of the connection of the train of the muscles and the tissue, the fascial tissue, is go into a calf stretch. And for the calf stretch, just simple from the same position, just bringing the leg forward. And I like people to just kind of sit back and pull back on this hip right here, sitting into that leg, pulling back this way, which you should feel that stretch in the hamstring. Back on that side, the more you pull and the more you sink, the more that'll stretch. You're going to spend about 1 or 2 minutes on that. If you want to bring in the gastroc or a little bit of the calf into it, you can pull the toe up, which pulls all the way down the line into the heel just a little bit. If you want to focus on just the hamstring, you can let the toe and the foot relax and just sit back into the hip, pulling in on there. One of the things I want you to focus on is sitting square into the hip, allowing this hip to face parallel and forward, not allowing to twist or rotate on this. So facing parallel, sit back into that, and be able to sit back and rock back and pull that nice and easy, stretching into that hamstring. Go ahead and do the same thing on the upper side. Remember, keeping your hips square. Sit back on that side. You may find, once again, one side is a little bit tighter or a little more flexible than the other side. You just want to spend a little bit more time working into that. Stretching, pushing back in that hip, pulling back and sinking back a little bit more. You can add the calf in or you can leave the calf out based off of what you feel like you would like to do. But sitting back in that hip, Once you spend about a minute or two stretching that hamstring side, then we're going to work on the next stretch, which is going to be in there for our adductor magnus and a little bit into our glutes on that back side of the hip external and internal rotator. So what we're going to do here is get back in that kind of that lunge kneeling position. And for this one, I like people to put their hand over the top of their foot in the front, and I want their knee to stay over the outside of what that would be. So you square up your hips, and what you're going to do is you're going to kind of sit inside that hip or sit onto that hip and rock kind of back and forth with that knee out to the outside a little bit, making sure you keep the foot in a neutral position. So that's what your hand here is helping you do, is keep that foot in a neutral position. You want to avoid rolling out like this to get that stretch. Keep that neutral there. That ankle will stretch out in that position. Sit down into that hip and spend some time kind of rocking back and forth to get that hip to stretch out there. Once you spend all that time rocking that back and forth, getting that knee to go out there, you can flare it out a little bit wider. You can bring it a little bit more narrow, but sit back in that hip. Try to neutral out the pelvis. Keep the pelvis neutral, sitting down into that hip. Once you get that side done, go ahead and work over the other side. Same thing. Once again, put your hand down here, keeping that foot in a neutral spot. Don't let it roll out to the side. Knee outside the elbow. You're going to sit down in that hip also. Spend about a minute or two in that spot, kind of rocking back and forth, working that out to stretch the hip out. You may find, once again, one side is a little more tight than the other. You can spend a little more time working on that one side. Just make sure you're working nice and deep into where that stretch is. Don't have to force the stretch. You're just trying to gradually work a little bit deeper in that stretch, help that hip open up and get some of the mobility, especially for that adductor magnus with this stretch here. Okay? Next, you're going to work into the hip external rotation, a lot of the glute stretch with this one. So with this one here, you just sit back and you're going to cross the one leg over the top of the other, and from there, try to sit up tall, get a neutral pelvis, a neutral lower back, and you kind of walk your hands up into here so this hip stretches, you're stretching down in this hip. And you kind of settle down in that. Try to force the pelvis into a neutral position, so straight up and down. It's not forcing you to arch your back or slump your back one way or the other. Keep a neutral pelvis and kind of settle down into that hip right in there. The more mobility you have, the more you can drop your knee down towards your foot, and the more you can kind of sink down into that stretch. When you have that side nice and settled for about a minute or two, go ahead and switch, same thing. Drop that foot over the top of the other side, settle down on that hip, keep the neutral pelvis, and kind of rock in there and work that hip out to the outside. Once again, to make the hip or make the stretch a little bit stronger, work yourself down a little bit lower into that hip, sink down a little bit farther. You can feel that stretch inside and on the outside of the hip there, especially in the glute area. You continue to work on that and settle down into there. Okay? Now, next what I like to do is kind of help maintain a neutral pelvis, a neutral pelvic position, as well as open up the hips just a little bit. So it's kind of like a modified child's pose, which is the yoga exercise. And with that one, I like the hips to be just outside of hip width apart. So you're going to line your knees up just side of hip width apart. And from there, you kind of get into the almost kind of like a starting, like a quad rocking or modified child's pose position. And you're going to, keeping the hips in a neutral position, sit back on the heels. Trying to let the hips stretch out, making sure to focus on the neutral pelvic position, because that's what's going to allow you to hold that position as you squat down. If you can do this fully all the way down with the hips comfortably, you should be able to drop all the way down into a squat, maintaining that neutral pelvic position. So from a side view, what you're looking for is you come here from this position here, and if you're sitting back, you want to maintain as neutral of a pelvic position here as you can as you settle back down your hips. What you're trying to avoid is forcing yourself into arching your back like this, which isn't good for the lower back when you squat, as well as the immobility that when you squat back, it arches your back and rounds your back out like this, putting that little bit of a flexion motion into the lower back as you sit. So maintaining that neutral pelvis as you go back. Now, oftentimes when people have immobility with this exercise, what they have to do is they kind of have to settle just a little bit, hold that for a second, and bring it back out, because they come here and then all of a sudden it pulls the back up like this. And you want to avoid that, so you only go back as far as you can control, settling into that position to help open up the hips there with that neutral pelvic position. Now you can modify that just a little bit also. You can do it in more of a neutral or a narrow stance with the knees. So sitting back like that. You can do it with that just outside the hip width stance. or you can do it a little bit wider. For those that like to squat a little bit wider or deadlift a little bit wider, you can go a little bit wider, sit back in that position there, and allow that to stretch out. About a minute or two, kind of holding in there. You may have to work one side a little bit more than the other, but that'll help open up the hips. Once again, if you can do this, then you can get the hips down into that neutral and good position to help squat with a full deep squat. So the next one we're going to work on is for the thoracic spine. So the thoracic spine often limits the ability to kind of round the back out and keep the neutral trunk position all the way up as you hold the bar behind your back, as you overhead squat, or even as you hold a front squat. So for that one, it's going to be the modified push-up or modified press-up is what it's going to be. So you're just going to be on your elbows, and what I want you to do is try to go one spinal level at a time, kind of round your back out and arch your back out to stretch into that backward extension motion of the thoracic spine. I don't want you to force the motion. I don't like forcing the motion into the lower back. Once you kind of feel the motion get pressured in the lower back, it's time to stop. Focus that motion on the upper spine of the thoracic spine. You can do multiple one of those, holding for about 8 to 10 seconds on each one, or you can just do one hold for a little bit longer, but 20 to 30 seconds. But you got to be able to maintain that focus of that stretch in the upper back or the thoracic spine. Okay? When you have that down for about a minute or two, then the last stretch we're going to do is we're going to work on the lat stretch. And we're going to stretch the lats out because of its cross connection with the glutes and kind of that fascial and anatomy train. So what you can do for that one is just going to go hand over head. You're going to pull the elbow over the top, and you're going to lean towards the opposite side of what the latature is stretching. So for stretching the right lat, you lean to the left. You're going to hold that for 1 to 2 minutes. Good stretch. Sometimes you can lean at varying degrees just a little bit to feel like you can get a little bit of a stretch. Then you stretch the left side, which you're going to lean to the right. Stretch that side there. You can, once again, vary your degrees just a little bit to feel like you get the best stretch out of that. 1 to 2 minutes. And then you come up after that and you can go back and check your squat to see your ability to kind of go down to that full neutral deep squat position. So whether it's from a front squat or whether it's an overhead squat, being able to squat all the way down, feet in neutral position, chest upright, being able to hold the neutral pelvis, and that's where you'll start to see this come around. So you want to practice working into that mobility from all those exercises you just did after you practiced or you ran through that mobility series.